Hey, welcome to Leaving CrazyTown with Finn and Sarah. What are we going to talk about today, Sarah?
We have a special guest today, and her name is Kate Vitela, and she's a fellow Sober Curator contributor at the Sober Curator online magazine. But we're going to let her tell us, kind of describe who she is for a few seconds, maybe. See, I'm already bumbling.
Uh,
And then we're going to get into a codependency topic. Kate,
Oh, I
tell us a
can't
little about
wait.
yourself.
she can't
Oh,
wait.
thank you. I can't wait. Yes, thank you for the introduction. I'm Kate Vitella. I live in the Pacific Northwest. I'm actually out at the coast right now. It's this very beachy vibe where I'm sitting, if you can see me, and I have a cup that matches the pillows. Thank you to my mother who decorates this place, and she's fantastic. Um, yeah, so gosh, I've been a nurse for over 2 decades. And right now, my specialty is psych and addiction. Yeah, I've been sober since 2018, and I've been writing for the Sober Curator, I want to say for 3 or 4 years now. I've blogged on fashion, lifestyle, I've done podcasting, travel. I mean, I've just been kind of along for the sober journey.
Yes.
So yeah. Take it
Awesome.
away. What you got for
Awesome.
me?
Okay, so what are we going to talk about around codependency today? Kate, we talk about nurses in the program and nurses having, high levels of codependency at times. I think any caretaking therapist, of course,
Mhm.
any caretaking job, we can struggle with our codependency. What angle would you like to discuss? Is there any certain relationships right now in your life or any particular relationship issues that you're looking at or struggling with or trying to change? Anything specific you can think of that might relate to our audience?
Well, first of all, I wanted to address my relationship with nursing.
Oh, perfect.
Having been a nurse for so long, I think it's a really good point you bring up. We were just talking before we hit record on nurses and codependency, and I am a nurse who was forced. I mean, I don't know how else you can say it, encouraged, nudged, voluntold into a monitoring program for nurses with substance use
Mm.
issues. And this wasn't until I had been practicing for 17 years. So I was far along in my career, and I was not going to admit that I had a problem until I was forced. And then I was putting this monitoring program as a condition to save my license,
Mm.
basically. And I
Yes.
got in this peer support group with other nurses. And what I found is that we were 10, 20-year, 40-year nurses. Like we were veterans. A lot of us struggling with burnout, a lot of us codependent issues, in a bit of disbelief that we
Yes.
were now the one in sort of the patient role.
Mm.
Like there was that role reversal. So I had to do a lot of grappling with my identity as a nurse.
Mm.
And we commonly throw around that adage like there is no us and them when it comes to caregivers and patients. We're all humans, right? But
Right.
I didn't think that way at the time. I really thought like I'm over here and you're over there. I'm not, I take care of you and you suffer and have all the problems and I'm the nurse, and like I just ignored myself. I didn't listen to my body. I stuffed it down, worked long hours. I, all the things, right? It was like classic. It was like, here's your textbook on being a codependent nurse.
Oh my God. Oh my God. Just all the symptoms, right? Burnout, lack of self care, focusing on what everybody else needs, neglecting
Oh yeah.
yourself. We talk about on this show abandoning ourselves and what we need. There's such huge components of codependency.
This
I
is
mean,
such
and what
a.
you're talking about, I was going to
Sorry.
say in denial.
Oh
When
yeah.
you're in that professional position, our denial can be so intense. How did you end up breaking through that denial and getting to the place of like, oh my God, I really am in it? I don't know what your drug of choice was, but how you're like, I really do have a problem. How did you get there?
Well, my drug of choice is alcohol. And
Yeah.
I would love to say, I woke up one day in this ray of light and I had this, you know, I just stepped onto this moral high ground but it didn't happen that way. I was forced. Like if you want to continue practicing as a nurse in order to protect the public, you need to go into this monitoring program. And that was like eating the whole humble pie all at once,
Mm.
like someone just shoved it in my face. And I needed to be forced though, because I was so stubborn and I was in such denial. And once I got into the program and I started connecting with other nurses, it was like we started to kind of finally admit, yeah, we have problems. Like
Mm.
we we drank in the morning when we got off work. If we worked night shift, we drank in the evenings. We just self-medicated. We did not take care of ourselves. It was always do as I say, not as I do to our patients. We
Mm.
were eating McDonald's, we were
Mm.
smoking, we were drinking. Some nurses were doing all manner of other drugs or what have you, but we were all doing something to self-soothe and to
Yes.
like completely abandon ourselves.
But
Yes.
It
Kate,
was
though,
like,
you did you went into the program. I have two nursing friends who are getting their careers back now, but were late in their career as nurses, were posed and faced with the same question, and they said, "Here's my license." And went
Wow.
and continued drinking. And one friend, it was like 9 more years of in and out of rehabs, and finally is now getting her license back, working to get it back in her 60s. And but even at that point, when they said, here's your crossroads, right? You're going to go into
yeah,
this program or you're going to lose your license. And they said, all right, well, we're not going to lose our license. We're going to hand it to you so we can continue what we're doing. And it sounded like a very similar story. They were the caretaker, you're the sick, the patient's the sick person, and going out and getting a lot of relief in the drinking. And alcohol is the drug of choice for both of those nurses that I know as well. And so hats off to you to to deciding like, hey, I'm gonna go this route, because not everybody does. A lot of
Right.
people will either wait till it's gone, someone's hurt, lost the license that way, or like couple of my friends did, hand it over because that wasn't as important as their ability to drink and feel relief from whatever they were still getting from that
Mm.
activity. So,
yeah, I'm glad you brought that up because I met someone early on in AA who had surrendered their license, and then circled back and is now in recovery. And I too contemplated surrendering my license because the whole thing felt like a mountain I just couldn't
mm,
climb. It
Mm.
was too overwhelming. It was too much. It just, this, because I had to sign a contract that I would be in this program for 5 years.
mm,
So that's not a drop in the bucket. That's a while, right? And it's expensive and it's onerous and scary and humiliating. And there was a part of me that tried to surrender my license, and I tried to mentally go there, and I even brought it up to the nursing commission, and they were like, you can't surrender your license, you're too young, you've got too long of a career. I mean, I could, but
Right.
ultimately it would have affected any other career choice I tried to pursue down the road, and
Yeah.
I have to pay my own bills. I mean, I can't, you know,
yeah,
no white knight is coming to save me.
right.
It's huge.
Yeah.
You know what I was thinking about too is that we often talk here that the codependency starts way before the addiction. And to me, it makes me think of how the addiction is just medicating all those underlying causes and conditions, like it talks about in the big book, right? So, I don't know what your growing up was like, but I'm sure some of the, caretaking or repressing our own needs or repressing our resentments or running from shame and fear or whatever was there. And then the booze, then you're like giving yourself away. Like I did the same thing in my career of being a therapist. Like I just got so fried, and it is a way that suddenly you're feeling depleted, and now the addiction, whatever it is, the relief seeking missile, that's the coping skill
Yeah.
instead of changing our old behaviors. So are you like when you look back, do you think of like, what was I medicating? What was happening with me while I was working for a nurse or as a nurse, or when I was working as a nurse, or when I work as a nurse? What did I think the booze was helping me with?
Yeah, yeah. That's a good point. You know, I think I grew up like a people pleaser,
Mm.
middle child syndrome, really wanting to blend and to, to be of service to the world, I guess. I don't know. I always wanted to fit in. And I
Mm,
had this maybe deep sense of not enoughness.
Mm.
And nursing kind of helped me feel important and feel like I was helping, also made me feel smart. I generated an income, I had some independence. um, but I self-medicated everything with alcohol. I was a registered nurse really young. I got my license, I think I was 21, 22, and went into work in a fairly high trauma setting. So there was anyway, it was a cardiac unit. But what I saw, what I heard, what I did, I shoved all that down. It was like taking care of myself was absolutely last
Mm.
to learning the role. And nurses are famous for, there's all these jokes for working a 12-hour shift and not going to the bathroom, and you know eating Cheetos for lunch. And there's memes that circulate that shows nurses meals, and it's like starve, starve, and then dinner is all these calories, but it says mostly alcohol.
oh,
um, I mean, all that kind of narrative,
Mm.
right? And to some degree, that's true because it's a hustle profession where you're on your
mm,
feet and it's exhausting and busy. And that's the culture, is to put
Right.
yourself last. It's
Mm.
like, you know, that's rewarded in nursing, to have that kind of, martyrdom in a sense.
Yeah, I don't think the system itself has figured out that the self-care first. We say in an airplane, put your mask on first.
Yeah.
And I've never seen that in the medical profession, especially with nursing. It's give, give, give. And I think also for me personally, like we get stuck in our identity. Like I'm the helper.
Yeah.
I'm the one, I'm helping you, and that becomes our identity. And the cash register gets empty, like the emotional cash register, the self-care,
Mhm.
everything. And I think you can only go on so long. And yeah, so
Yeah. It was also a nice excuse to not focus on myself,
mm,
right? To
right.
not take care of myself, to, you know, it almost like slip into kind of the victim mentality, like, well, this job is so stressful and
Yeah.
I have to drink 10 energy drinks and a bunch of wine, and I have to, all these unhealthy things that I had to do, and then I could ignore any of my own problems. I could
right.
ignore, I could avoid looking in the mirror because I had
Yeah.
so much other stuff.
Are you still working as a nurse now?
Yeah, yeah. I
How is
work
that?
in,
How is it different for you now that you have this awareness and you are trying to take care of yourself? And does your nursing practice look different, or how you approach life and other things in your area, like where you're like, okay, I need to take care of me, and this is where I brought myself, and how does that look different for you today?
yeah, when I re-entered the nursing workforce, once I had signed the contract and started the monitoring program, I went from being into cardiac nursing, operating room, all those types of nursing jobs, into mental health.
Mm.
So for the last 5.5 years, I've been working inpatient psych, and I got certified as an addiction nurse and really dove into that world.
Mm,
Um, and yeah, it does. It totally looks different because I recognize when I'm getting to that point
yes.
of burnout, and I
Mm.
I don't let myself go there. I'll step back. I'll come out here to the beach. I will, you know, I pick up on those things because I no longer pride myself as a person who overworks, overstresses,
Mm,
overdoes.
Yeah.
That's not my
okay.
identity anymore.
Yeah.
It's so good. It's so funny because I'm doing these pitches. It's a long story to this publicity summit. And you have to say something kind of that hooks people. And I've literally been saying codependency kills people.
Yeah.
And how I say it is untreated codependency, you can either use addictions to do it, or you'll get depressed, or you'll get anxious, or you'll be a rage machine and kill yourself in a car, or you'll kill yourself, or you'll get physical illnesses. I mean, there's
Yeah.
so many ways our bodies respond to chronic stress, chronic, energy going out, not enough coming in, addictions being one of them. So it's
Yeah.
such a great topic to talk about the depletions that can happen, because it's a huge part of codependency treatment. And the first tool in my book is rest. Because by the time you get to treatment from codependency, you're freaking exhausted. So this is such a great topic.
Yeah, I know
Go
I
ahead,
got a
Jen.
lot of hits out of like achievement, doing, doing,
Yeah.
doing. Look at me. I didn't know I closed 140 cases this year, and so the next person in my office closed 70. And look at me go. And I when I got sober, I shifted from doing to being. And I still can get wrapped up. And
Yeah.
I was telling Sarah the other day, balance is like still my struggle. And I don't know if it's the
Yeah.
addiction piece where I've got to go. I finally feel balance and rest. And then after a few weeks, my friends are like, "You seem really busy." And I'm like, "No, I'm not. I'm fine." And next thing you know, I hit a wall. And I'm like,
Yeah.
"What? How did I get here again?" I'm still
Yeah.
going, "Wah, wah."
Right. Right.
Yeah. I'm curious if you feel like with the codependency, because one thing I notice is that when I am falling into all that, I get so resentful. And that's part of what I shove down and self-medicate. And I'm just
Yes.
wondering if that's part of your
Yeah. I mean,
dialogue.
It
yeah. I mean,
absolutely is.
resentment. Go ahead,
Sorry.
bud.
It is for me. And, I've
Yeah.
been through the steps out of the big book. And one of the things that's really helpful to me is getting to look at and continuously writing 10 steps and being like, all right, I'm resentful. And then
Yeah.
the way I do the writing, I do turnarounds and I get to see, oh, well, I did this, this, and this. I set the ball rolling and now I'm mad about it. And I can get mad at myself too. But and I don't like getting myself set up for failure where I've got involved in too much and then I've got to pull back and then, and I start getting mad at everybody who needs all the stuff from me because, whatever, but I could see how I put myself in that position. And stuffing it, the one good thing I've gotten, well, there are many good things I've gotten out of sobriety. But the one good thing that really helps me today is I don't like to feel uncomfortable. I don't like to be
Mhm.
miserable. I don't like to be angry. And
Weird.
yeah, so I will look at that stuff and I know that no, I'm not changing anyone else to make it better for me. It has to be me. And if I have a resentment, then I know I've done something I need to look at, which is,
Yep.
it's brutal, but it's definitely and I don't think it ever goes away. And that's the whole point of when people wrote the steps that there's a 10 because we're going to continuously get ourselves in these situations.
Yep.
Yeah. And that it is kind of the classic paradigm of the codependent. Like, in the old days, like, I'm going to keep trying to save you from your alcoholism. But meanwhile, I'm going to be enraged because I'm doing it. So I'm doing all
Yes.
these behaviors, but I'm pissed off about them. So, I
Yeah.
mean, that's why codependent recovery is all about, okay, I got to stop focusing on fixing you and just think about what I want and need. Because
A,
you're absolutely right. Resentment and rage are quintessential components of addiction and
Mhm.
codependency. So, absolutely great
a,
point.
a crazy story that I think's really funny, and I'll do it quick. When my wife got divorced from her previous husband, and they were really good friends, and she was dating me, and she would make dinner for her ex-husband because she had done it for 30 years. Come to my house, make dinner for me. I'd come home from a 14-hour day in Boston, and she'd be raging at me. And I just looked at her. I'm like, what is going? She's like, well, I had to make Dawn dinner and now I'm making dinner. I said, what do you mean you had to? I didn't ask you to make dinner and I don't want to come home and eat rage. So, so she
Rage
finally
cooking.
said to her ex-husband, like, I
Rage
can't make you
cookies.
dinner. And he was like, thank God. Like both of us were like, who are you? And who asked you to do any of it? Nobody did. Like, I don't want to come home to somebody who's like banging pans and like yelling at me about how they're so crazed because they had made dinner there and now they're making dinner here. And it's just funny because you don't, until it comes out, you
Right.
can't even see it sometimes what we're doing. But she was just so rageful. And I'm like, I'm not eating rage food. Sorry.
But what
I
are her
want
own
a
choices?
t-shirt. I want a t-shirt that says, I'm not eating your rage cookies. I love that so much.
Oh my God. All right. We're going to have to, should we give a tip or a tool? Like what would be, because we got to wrap up, I'm sure. I don't know what time we're at, but.
Well, I was just gonna say, yeah, we're gonna have to wrap it up, and I was gonna ask Kate if there's anything that you want to add, like uh, any suggestions you might have for our audience, or anything you want to say last minute, throw out there before we end.
Yeah, yeah. So I launched my own private coaching practice a while ago, and I do recovery coaching on the side of nursing. And just a little, I just
Absolutely.
shout out for myself.
Yep.
So also, I love this topic of resentments because one of the things I work on with clients is we list, just like in 12 steps of AA, because I also did that and found that to be very helpful, is we do list resentments and then we work on recognizing as they resurface and resurface and ways that we shove them down.
Mm,
And I just think that's a really key part of our ongoing recovery because every day brings a potential for a new rage cookie. And
yeah.
so this is our life's work, right? Is to not be a rage eater, rage cookie eater.
Yes, excellent. I do like a cookie, but not a rage one.
That's
So,
true.
how about if you maybe Sarah has your contact information if anybody's looking for any coaching or wants to reach out, we'll put it in our write up for this video before we
Yeah.
publish
And
it.
I know you're on Instagram, and I think people could follow you on Instagram as well, right? Yeah.
Mhm. I am all over the socials. I
You're a
am
social. Okay.
I'm very
Awesome.
social. And you know what? I encourage other nurses who might want some help or coaching to Google me because when
Yes.
you do, all my shit about my nursing career comes up on my license. It's public knowledge.
Okay, got
So
it.
All right.
see it all.
Perfect.
I want you to
Perfect.
see it all.
We love it.
All right.
Awesome.
You heard it here. We're leaving Crazy Town. Thanks, Kate.
Thank
Fasten your
you.
seatbelt and don't eat any rage cookies.
No rage cookies, people.